Hello everyone, my name is Li Lu. Today we will learn the Filiform needle and some commonly used needling method. Firstly, let us review the concept of acupuncture. Acupuncture or needling, it is a type of therapy that stimulates certain locations or points of the body. By manipulating needles or other similar instruments. So, what are the development of special instruments, needles? In order to understand it at the beginning, we should acquire the history of needle instrument. Since we know that there was no iron casting in ancient time, so the needles were made of stone. It means the stone instruments were widely used in the primitive society. In the New Stone Age, because of the improvement in their technique of stone manipulating, the ancient people were able to make bian stone as a special tool. It could inciting abscesses and for bloodletting. The bian stone is the primary instrument for acupuncture. After that, another type of instrument was still founded in New Stone Age, called bone needle. It was more thinner and sharper than the bian stone. Ancient people usually use bone needle to make a knife for clothes, and it could use for acupuncture and prick to blood. Now, in clinic, the stainless steel Filiform needle are extensively used, like this. Okay, so why we choose stainless steel for the Filiform needles? There are 5 factors here, respectively the high intensity, elasticity, no corrosion, and inexpensive. Finally, there is a very important advantage of stainless steel Filiform needle. The steel Filiform needle have a higher conduction of electricity and heat. So we could apply the electroacupuncture and the warming needle. Next part, we should know the structure of a Filiform needle. A Filiform needle can be divided into 5 parts, respectively the handle, tail, tip, body, and the root. The handle means the part which vibrates with finger of stainless steel. The tail means the part at the end of the handle. The tip means the sharp point of the needle. The body is the part which between the handle and the tip. The root is the demarcation line between the body and the handle. Here for the gauge of a Filiform needle. The gauge of a needle is determined by its length and diameter. In general, the length and gauge refer to the dimension of the needle body. Here are 2 tables to show the common Filiform needles, which vary in length and diameter. Please look at the tables. The unit of the length in Chinese is cun, and it could also measured by millimeter. The diameter of the Filiform needle could also be measured by millimeter. Clinically, the needles from 26 to 32 in diameter and 1 to 3 cun in length are most frequently used. In details, the location of the acupoints, the condition of the patient, and the stimulation intensity should all be considered to choose the needles. In the next lecture, we will explain how to choose an appropriate needles for treatment. We have already learned some basic knowledge about the Filiform needles. So here is the key part, how to insert the needle into skin surface. Actually, there are 3 methods here, and we should practice the needling skin in this sequence. Firstly, practice your finger force. Secondly, practice common manipulations. Conclude practice the quick puncturing turning, rotating, also the lifting and thrusting manipulation. Finally, you could practice in the body of yourself. Well, the posture to hold the filiform needle is also important. We could hold the needle with the thumb, index, and middle finger of the right hand. In doing so, the needle should be kept upright, as if holding a Chinese writing brush. Also pay attention to that we should keep the needle body vertically to the paper pant or cotton ball. As the filiform needle is fine and flexible, it is very difficult to insert it into the skin without some stressing. Finger folds is a guarantee to minimize the pain and improve the therapeutic effect. So we could practice the finger folds on a paper pant or cotton ball. Here we just talk about how to practice finger folds on a cotton ball. The cotton ball is made by wrapping some cotton with gauze or cloth and binding it tightly with thread, like this one. And then hold the cotton ball with the left hand, needle handle with the right hand. Just before the needle tip touches the bone, finger folds is gradually exerted to make the needle enter the bone. Keep doing so until the needle can be inserted smoothly and rapidly into the bone. Well, the next procedure, we should practice some common manipulation. Firstly, the quick puncturing. Quick puncturing should still be practiced on the paper pad or cotton ball. But here, we should pay more attention that the inserted needle must vertically into the appropriate point on board. Keep the depth of 2 to 3 mm and repeat this motion. This method is to train the handles insert the needle more quickly and free of pain. After we have acquired the insertion of needle, next time we may start to practice two commonly used clinical manipulation. When needle is inserted, use the thumb and index finger to hold the handle and twist it on the original spot clockwise with the thumb moving forward and the index finger moving backwards. And then counterclockwise with the thumb moving backwards and the index finger moving forward. Another commonly used method, lifting thrusting manipulation. After insert the needle into the cotton ball, use the thumb and index finger to lift and thrust the needle repeatedly. When doing so, the needle should reach the desired and appropriate depth. And finally, we could change the cotton ball to the body. Try to insert needle into your skin surface. Of course, you could practice with your partner. In Chinese, there is an idiom, practice makes perfect. Try to practice more and more, you will acquire this technique quickly. Thanks for listening.